Most people have a clear mental map of the dirtiest places. Coli and Klebsiella pneumonia, a pathogen capable of infecting the lungs, urinary tract, and bloodstream, as common inhabitants of kitchen sponges. Salmonella and Staphylococcus aureus, which causes the dangerous MRSA infection, are also frequently present. Studies show these pathogens can survive on a kitchen sponge for up to 16 days. Staph infections are associated with approximately 20,000 deaths annually in the United States. Exposure can begin after as few as 2 or 3 uses of a contaminated sponge, according to the Academy of Nutrition and Dietetics. The practical response involves both regular sanitation and timely replacement. Microwaving a wet sponge, never a dry one which poses a fire risk, for 1 to 2 minutes kills the majority of bacteria through heat. Running the sponge through a dishwasher on its hottest cycle achieves a similar result. A 1-minute soak in a diluted chlorine bleach solution is also effective. Even with regular sanitation, sponges should be replaced every 1 to 2 weeks. The clearest sign that replacement is overdue is odor. A sponge that smells has reached bacterial levels that sanitation may not adequately address. The toothbrush presents a microbial situation that most people find genuinely surprising. Research from the University of Manchester found that a single toothbrush can harbor more than 10 million bacteria and fungi across its bristles. For context, this is considerably more microbial life than exists on the average toilet seat, which carries approximately 50 bacteria per square inch, or even most public restroom floors. The organisms found on toothbrushes include E. coli, Klebsiella, the yeast Candida, which causes fungal infections, and Streptococcus mutans, the primary bacterial driver of tooth decay. A significant contributor to toothbrush contamination is toilet proximity. Every time a toilet is flushed without the lid closed, it generates an aerosol plume of water droplets containing fecal matter and any pathogens present in the bowl. Research from the University of Colorado demonstrated that these particles can remain airborne for minutes and travel several feet, landing on nearby surfaces, including toothbrushes stored on the sink. Approximately 70% of used toothbrushes assessed in one study were found to be heavily contaminated with pathogenic microorganisms, a finding that strongly implicates the bathroom environment as a contamination source. The American Dental Association's guidance on toothbrush hygiene is measured. While toothbrushes do harbor bacteria, there is no established evidence that this bacterial load causes adverse health effects in healthy individuals, since the immune system manages much of this exposure. However, for those who wish to reduce their risk, several practices help. Storing the toothbrush in an upright position and allowing it to air dry between uses limits microbial growth, since moisture is a primary enabler of bacterial proliferation. Closing the toilet lid before flushing significantly reduces aerosol contamination of nearby surfaces. Soaking bristles in antibacterial mouthwash or 3% hydrogen peroxide provides additional sanitation. Toothbrushes should be replaced every 3 to 4 months or sooner following illness, at which point the bristles also tend to have degraded in cleaning effectiveness. Microwaving a toothbrush is specifically discouraged by the ADA, as the heat can damage the plastic handle and bristle structure in ways that compromise its function. The hairbrush. Hairbrushes are rarely thought of as objects requiring cleaning, but they accumulate a substantial and biologically active mixture of shed hair, dead skin cells, scalp oil, product residue, and the microorganisms that thrive in a warm, oily environment. The scalp is naturally hospitable to bacteria and fungi, and regular brushing transfers these organisms directly onto the bristles, where they persist between uses. Dermatologists note that the scalp's normal skin flora includes bacteria, fungi, and even microscopic mites, the balance of which can be disrupted by the redeposition of accumulated material from a dirty brush back onto the scalp with each use. Staphylococcus bacteria are of particular concern in hairbrush hygiene. Staph commonly colonizes the nasal passages and skin and can be transmitted between people who share hairbrushes, leading to pustules, boils, and skin infections. Using a dirty hairbrush also redistributes accumulated scalp oil back onto hair that has just been washed, contributing to greasiness and potentially worsening conditions like seborrheic dermatitis, which manifests as dandruff and scalp inflammation. Dermatologists and hairstylists recommend cleaning hairbrushes every 1 to 2 weeks. The process involves first removing accumulated hair from the bristles, then washing the brush with warm water and a mild shampoo or dish soap, scrubbing between bristles to dislodge built-up oil and debris, and allowing the brush to dry completely before use. A practical daily habit that reduces the burden of periodic deep cleaning is removing shed hair from the bristles after each use, which prevents hair from matting down into the brush base and creating a more difficult cleaning task. The common thread. What these three objects share is that their association with cleanliness, whether they are used to clean dishes, teeth, or hair, creates a blind spot in how most people think about household hygiene. Objects that seem clean by virtue of their purpose require maintenance just as thoroughly as the surfaces we more intuitively recognize as dirty. The microbial populations they accumulate are genuine, in some cases potentially harmful, and entirely preventable through straightforward and inexpensive cleaning habits. The frequency recommended by experts for addressing each of these items, weekly for sponges, every few months for toothbrushes, bi-weekly for hairbrushes, is modest relative to the health risk that neglect